Hello there, RevDivers. We are super excited today to introduce you to Amy Weiser. She is the lead project coordinator at Quality Insights for the QPP Service project. She's an RN with half a dozen certifications, including PMP and PCMH designations. Amy, it's super clear to us that education is just as important to you as it is to both of us. And so we are so excited to have you on the show.
Thank you so much. It's a pleasure to be here.
So our RevDive audience is on the constant hunt for credible resources, right? Those quality improvement organizations, the QIOs that are aligned with CMS, play a significant role in information sharing with the QIO concept. Um, for those who may not really be familiar with it, could you give us some insight into your relationship with CMS and how organizations can tap into that support system?
Absolutely. Thank you. As the Centers for Medicare and Medicaid Services chartered quality improvement or quality innovation network, quality improvement organization, otherwise known as a QIO, for Pennsylvania and West Virginia, Quality Insights provides no cost education, data, and networking and technical assistance. And we really work to pursue the nation's healthcare goals of better care, smarter spending, and healthier people. And, we try to tailor our education, according to the needs of practices and clinicians and the entities that we work with. We also collaborate with providers and communities and people with Medicare through data-driven initiatives. And we have a whole host of opportunities for our clinicians and practices in Pennsylvania and West Virginia to work with us on improving behavioral health, decreasing adverse drug events, increasing patient safety, increasing chronic disease self-management, including cardiac and vascular health, diabetes, and chronic kidney disease. We also help with increasing the quality of care transitions and utilizing community coalitions, reducing hospital admissions and readmissions, and reducing avoidable emergency visits. And we also work on improving nursing home quality within the QI and QIO. Additionally, Quality Insights offers many other projects that practices can take advantage of. In Delaware, we have the Health Plan Connect, which is the navigator program to help patients and beneficiaries access affordable health care. We also have the external peer review program, the renal networks 3, 4, and 5, and we have the state public health initiatives in Pennsylvania and Delaware to help with hypertension, diabetes, just to name a few. And we also have a DISCO e-learning and collaboration.
Awesome. That's a mouthful. Amy, just thinking about the different changes that are happening in the quality payment program, it has gone from meaningful use to, so many different iterations. MIPS is obviously on the radar of medical practices to make sure that they are understanding, their compliance with all of the necessary measures, making sure that if they're able to get any bonuses, the incentive payments that they can, then obviously avoiding those penalties. Unfortunately, some of those measures trip us up, and we're trying to understand them, trying to do, workflow redesigns and ways that we can kind of roll out best practices so that we can incorporate MIPS into our overall operations. If you could just give us, from your, perspective, what are some of, at least one piece of advice that you would share to help folks improve their participation and attestation for each of the, quality improvement activities, promoting interoperability and cost categories? Maybe just like a snippet of something that we need to be on the lookout for.
Oh, absolutely. Yes. MIPS has, been challenging over the years, and we've been very fortunate to be able to help practices in Pennsylvania, Delaware, West Virginia, and New Jersey, the small practices with, all of the MIPS nuances, so to speak. So I would say for quality, selecting measures that are meaningful to your practice is the first thing. And you want to do that early in the year, because that is a category that you collect data for the entire year, the 12-month period. Also, it's tied with cost at 30 points now. So it has the most points for the traditional MIPS scoring with cost. And I would say always reviewing the measure specification sheets each year according to the collection type that you're using. For example, you could, as a small practice, you can still submit quality measures through Medicare Part B claims. You can use a registry, you could use an EHR, but they each have their own specifications. And you want to make sure that, that you're looking at those specification sheets so that you're coding and capturing data correctly. And again, if you're looking for measure specifications, the best way and the easiest way to find them is on the QPP website, which is qpp.cms.gov. And you go to the MIPS tab and you click on the Explore Measures and Activities under the MIPS tab, go to the quality category, and then you can see the measures and the specifications. Improvement activities are another category for MIPS, and it's probably one of the easiest, I would say, in terms of the categories to implement. Like measure specifications for the quality measures, you need to understand the data validation requirements for the activities that you select and attest to. And you can also look for more information about data validation on the QPP website. They may not have the 2022 data validation ready yet, but if you go to the resources tab on qpp.cms.gov, you should be able to find those. You can also get more information on the Explore Measures and Activities tab, like you did for the quality measures. You can find the specifications there as well. Promoting interoperability. Small practices, and when we talk about small practices, we're talking about practices that have 15 or fewer clinicians, do not have to report promoting interoperability in 2022, and do not have to file a PA hardship if they don't want to participate in that category. And the points for PI will automatically be reweighted to and assigned to other categories. So what that means is promoting interoperability is worth 25 points, but as a small practice, those points are shifted into other categories. So you don't lose the points when you're not reporting that category. Cost is the last category for traditional MIPS. It is automatically calculated by CMS for you through administrative claims. So there's nothing that you need to attest to or submit for cost. Bear in mind, though, it's worth 30 points now. So it's equal with quality. And so it's worth a lot of points for MIPS. So you want to make sure that you understand cost. You can look at your historical information in the QPP portal, which is also at qpp.cms.gov. You can also look at their cost resources to help you to improve your cost scoring.
Awesome. Thank you. That was really insightful.
Thank you.
There's so much, I think, for everybody to know, and it's really super useful for us, especially every so often, to have a session like this where it's educational, right? And we're helping provide some guidance to people. It would really be nice to have some of these administrative burdens taken away, right? And we know that this is something that's been on CMS's radar, looking at the consolidation and the alignment of those MIPS measures. And so we're expecting changes to come out in 2023. What do you think, what changes and improvements should we expect to see in that MVP program?
Well, I would say in a nutshell that the MVP, or the MIPS Value Pathways, as they're known, is designed to reduce provider burden. If you look at it, it's kind of like a pyramid, and there are diagrams on the QPP website. And it's really a reporting framework that will offer clinicians a subset of measures and activities. And it's designed to work with relevant specialties, medical conditions, or episodes of care. And they're tied to the CMS goal of moving away from siloed reporting of measures and activities towards more focused sets of measures and activities that are more meaningful to a clinician's practice, specialty, or public health priority. CMS actually finalized 7 MVPs in the 2022 rule. As you stated, it's going to start in 2023. So it doesn't start yet for in 2022. But if you're thinking about, doing the MVP moving forward, this is the time to start, maybe doing some planning. And really, it's designed to help with keeping the patient at the center of their work, as a practice, and, it help to achieving better health outcomes and lowering costs for patients. And CMS anticipates that MVPs will result in comparable performance data that helps patients make more informed healthcare decisions. So again, it's designed for burden reduction and more alignment across the different categories. Promoting interoperability and population health are the foundation of the pyramid, and then building up from there are the quality measures and the improvement activities. And the way that I understand it, I believe you only, in the MVP, would only report 3 quality measures, and I still think you would still have the regular improvement activity requirements. But for more information, you can find the MVP page at qpp.cms.gov.
Awesome. Just also thinking about the kind of world that we're living in right now, doing a lot of virtual care delivery. We're also seeing a lot of phishing and hacking attempts in the healthcare space. Um, we already have, one, goal to make sure that we're doing the best that we can to secure the privacy and security of our PHI and our ePHI through our security risk assessment. But we understand that there's a new, safer EMR self-assessment, and it seems like disaster recovery is also a key focal point right now. Having downtime protocols, making sure that our patients are safe, using things like clinical decision support. Can you talk to us a little bit about the safer EMR self-assessment and kind of help us unpack this new requirement? Because it's obviously a part of the MIPS program for 2022, but as we understand it, we're not going to get scored for it.
Yes. So, first of all, where you can find the safer guide is at healthit.gov, and then /safety/safer-safer-guides. Even if you just go to healthit.gov and put in safer in the search, you should be able to find the safer guides. Really, what it is, there are 9 guides organized into 3 broad groups, and the guides enable healthcare organizations to address EHR safety in a variety of areas. Most organizations will want to start with the foundational guides and proceed from there to address the areas of greater interest or concerns. And what the guides do is they help to identify recommended practices to optimize the safety and the safe use of EHRs. And there is a really nice YouTube video, actually, when you go into the safer guides that helps to explain what they are and how they're to be used. So I highly recommend the YouTube video. I found it to be very helpful. especially because this is something very new. You know, we're all used to the security risk assessment, and so this is another layer kind of to that whole concept of, you know, protecting health information. To meet the measure in 2022, MIPS eligible clinicians must attest yes or no to conducting an annual self-assessment using the high priority practice guide. So when you go into the safer guides, you're going to see that there's the three groups: the foundational guides, the infrastructure guides, and the clinical process guides. The high priority practices is the very first guide found under the foundational guides. If you click on the link, it takes you into the guide, excuse me, and it helps walk you through the process.
Awesome.
So it's the first of the 9 guides. And according to the specification sheet for 2022, because I just found it on the website yesterday, so CMS is starting to load more 2022 information into the QPP website. You want to look at the specification sheet, and what it says is that in 2022, eligible clinicians will be required to submit one yes or no attestation statement for completing an annual SAFER guide, but the yes or no attestation response will not affect the PI performance category score. So they want you to comment on it in order to get any score in the PI category if you're submitting PI. That's it in a nutshell. So, but again,
Wow.
more information is in the QPP website. So.
Amy, this has been a very educational episode of RevDive, and we thank you so much for your knowledge, for sharing the countless URLs, for giving us your time today. Our RevDivers are really going to enjoy listening to this particular episode again, as it's so educational. Thank you so much for being with us today. And until we meet again next time, Rev Divers, stay digging into those Rev cycles.